Yes, sorry for the mix-up. I had a laptop crash, but I will talk about sewage surveillance of COVID-19, and first acknowledge the co-workers of the studies that we are doing in the Netherlands on SARS-CoV-2 in wastewater and how you can make use of that. And I think having these co-workers both from the public health side, so our Erasmus Medical Center and our Municipal Health Service of Rotterdam, then on the other end, the water authorities that have the access to the wastewater and the research institutes in between is a good format for successful research in this area. So surveillance of wastewater is by definition, of course, population surveillance, because wastewater is a mixture of a population, and depending on the size of the wastewater treatment plant and the place that you place your or you take your sample, it could be from anywhere from a couple of hundred to a couple of thousand to even up to 1 million people that is mixing the sample. And the use case of any surveillance program is, of course, to look at COVID-19 trends. And we've been looking at trends. Everybody is looking at trends to see what the virus is doing, first wave, second waves, and effects of lockdowns, effects of vaccination. And what I'd like to illustrate is how wastewater surveillance could add to the other ways of surveilling what this virus is doing in our population. And of course, we see that surveillance is usually done through looking at or taking samples from people that have symptoms and get to the testing streets. And a proportion of those are hospitalized and end up in intensive care units, and that's what we are trying to avoid as much as possible, or to limit as much as possible. But we also know that not everybody is turning up at the testing streets because they don't want to get tested, or they don't have any symptoms, or asymptomatic carriers. But everybody is going to the toilet. So there is an advantage, an objective advantage of using wastewater. So then the first question we had, and that is almost a year ago now, is sewage sampling at a wastewater treatment plant, where you have a dilute sample. Is it possible to, is it sensitive enough to pick up the signal of COVID-19, and is it early enough to serve as an early warning signal? So concentration, what we basically did was we already had methods to concentrate viruses, enteric viruses that are particularly waterborne viruses that we knew from wastewater, and we combined that with the method that was just coming out of the clinical virology labs on detection of the new SARS-CoV-2 in clinical samples. So we concentrated the viral RNA from the wastewater, concentrated the virus, extracted the RNA, and then initially started with 4 targets. We now have, we focus on only 2 targets, the N2 gene and the E gene, and of course have the adequate controls. And then the concept of sewage surveillance is pretty straightforward. The more shedders in the population, the higher the concentration in wastewater. And then you could reverse that. The higher the concentration in wastewater, the more shedders you have in your population. And the first question, of course, was what will happen if we do that, if we start to look in wastewater. And we did that early February of 2020, before the virus was in our country, or at least registered in our country. And we also did not detect any SARS-CoV-2 RNA in wastewater, which was for us also a good signal, because we wanted to understand whether wastewater was not giving false positive signals. But then in early March, a week after the first case was reported in our country, we found traces of the virus in different places in our country, including places like Amersfoort, where there were no cases registered at the moment that we first found SARS-CoV-2 RNA in the wastewater of Amersfoort. And then, of course, we wanted to compare what we found in wastewater in concentrations with the incidence or the reported cases per 100,000 and the cumulative reported cases in the different cities. And you see different cities with different epi curves in the city. And we wanted to understand whether there was a relation between the two. And yes, there was. These are our initial data that we had in the beginning phase of the first wave. And they already showed a good correlation. And now with all the data that we have collected since, and also many other researchers have showed that there can be a good correlation between the above ground and the underground information. So the sewage concentrations and the data that are collected by surveillance of humans in the testing street. So the use case of the sewage surveillance is then summarized here. You have a population, some reported infections, some unreported infections, and certainly at the beginning, certainly in the first wave, there were many unreported infections that has been changed with the second wave, as I'll show you in a minute. But wastewater would pick up the excreta from both populations, and we would be able to pick up the signal in the wastewater and then inform about the trends in the of the virus, the COVID-19 in the population, and support the lockdowns and other measures. So here is the data from two cities, Amsterdam and Utrecht, in our country. Orange is the wastewater signal, blue is the reported COVID-19 cases, and gray is the hospitalizations. And what you see is that trends are pretty similar. What you also see is that the first wave in blue is much lower than the second wave. But if you look in the wastewater, the first and second wave are about equal in height, and that is because this difference between the wastewater and the reported cases is particularly the testing efficiency in people's testing. So in the first wave, there were much less people tested, and the testing policy was much stricter than in the second wave. So I think this already indicates that the wastewater is a pretty objective way to look at the size of the virus circulation in a population. And it also shows the trends. It shows that the trend, particularly at the beginning, was also, we detected it about a week, 6 days before the trends in wastewater. Here you see again, wastewater is an objective way. Here's Amsterdam again, and now plotted on a linear scale. And the relation with the testing policy, the graph on the left is in Dutch, but I think you can understand the gist. It's the number of tests in the green bars, the number of positive tests in the orange bars, and then the red line showing the percentage positive. And if you compare percentage positive with the wastewater signal, you again see a fairly nice correlation between the two. So we think the use case, if you sample frequently enough, is an early warning of the trends of the virus circulation in a city, a country, a region. We are also looking into sequences, I'll come to that, to look at virus introduction history and circulation of new variants. We see that it can be used as decision support tool in high prevalence situations where we are in now. It is supportive to look at the trends of SARS-CoV-2 circulation, and in low prevalence, it could be used to identify new hotspots. I'll come to that in a bit. We are now zooming in with our wastewater surveillance together with Erasmus Medical Center and other partners in sub-city areas in Rotterdam, where we do high-resolution sampling. So here you see a map of 4 city areas that we sample separately with the number of people that are living in these areas, where we sample what I call above ground and below ground in a very high resolution. So we get the COVID cases that are reported in these areas, hospitalizations. We also get the general practitioner information from these areas, and we also get the wastewater information at a resolution of 3 times per week. And the question is, how do these surveillance systems match? How do they correlate? Will it produce an early warning in districts? And we are also zooming in further. So here is further areas where we sample at pumping stations, and we have these auto samplers installed to sample the wastewater. And to show you what we see, this is an example. These are the large city areas of 50 to 100,000 people. And what you see is the second wave. And there's some variation over time, but it's relatively limited. But if you look at a smaller catchment, so with fewer people, that you see that there is more variability. Maybe in this area, we also saw the rising trend a bit later. But that's the type of information that you can collect, and also the sensitivity, because the above graphs are about 100,000. The below graph is about 10,000, and the smallest is that we sample is about 5,000. We're also looking at trying to combine what we know from virus shedding and prevalence or incidence of cases and decay of the virus signal in wastewater to try and make a quantitative connection between the two worlds. But this is mostly governed by virus shedding rates, and virus shedding rates are pretty difficult, particularly because the highest shedding is around onset date. And if you look at the data on the top right, most of the data are later than the onset date. So we are trying to collect, or we are collecting fecal samples, and we're trying to collect fecal samples from around the onset dates to inform us. So then the question is it an early warning? Here is the different areas that we are sampling. In red, the testing street data from the people, and in blue, it's the sewage samples. And if you zoom in on one here, you see the data, and of course we can look at the amount of early warning that we see. But actually, when certainly now in the second wave, when we also have information about the delay in testing in the testing streets, and if we correct for that, actually the two lines start to coincide very nicely. So which you would expect, of course, because people don't start to shed a week before they get the virus. The highest shedding is around the onset date. So it's nice to see that with information about the delay, we can even make the match between the sewer data and the testing street data better. We could also look in another way, and that is comparing different areas. The Municipal Health Service has an indication that there is under testing in certain areas, and we can, by comparing the number of people in the testing streets and the positive test and the sewer signal, we can understand whether in certain areas we see under testing, or whether we can confirm under testing, so that there are less people reported positive than you would expect from how much virus signal you see in the wastewater. And that is now used to increase the testing in certain areas in this city. We can also do sequencing. That's complex, more complex in wastewater than in patients, because wastewater is a mixture. But when you do this carefully, you can see that what you would expect, that the viruses that are circulating in a certain city is also what you pick up in the wastewater. But you can also see that there are novel mutations detected in the genomes that you find in wastewater. And we are now, of course, trying to see if we can find the British mutation, the variant, and the South African and the Brazilian variant mutations also in wastewater. And that is done in collaboration with Erasmus Medical Center. And we have expanded our wastewater sampling to an area where there was an outbreak with the British variant, which was around Christmas time. So that is data that we are still collecting. In the Netherlands, there is a national surveillance program run by the National Institute of Public Health. And this is on our national dashboard, and that is all the wastewater treatment plants in the Netherlands, 318. Weekly sampling, but they are moving on to daily sampling and reported on our national dashboard here on a national scale, but also on a municipal scale. So you can look at the trends, and this supports SARS-CoV-2 circulation observed in other surveillance systems. So talk about the use case. This is where Europe is at the moment, or well, a week ago. Here, the use case of looking in wastewater is to have an objective indication of the virus circulation, an early indication when your testing facilities are not up to speed yet, and supporting the decisions on lockdown. And it's, as I said, an objective support information of how much virus circulation there is. I'll move to this one. This is where we hope to be as soon as possible, of course, in Europe. But if we look, for instance, in Australia now, they are already in that setting. And what is the use case of sewage surveillance in those types of settings? And that is an early warning of resurgence. So use wastewater as an independent check, because testing streets are running empty because there's nobody showing up anymore, except the people in the quarantine hotels, but to have an independent way to confirm absence of virus circulation in the community, or to detect it sensitively in certain areas as an early warning. So this is an example from New South Wales where they are sampling the wastewater, and you see that generally they are in the green zone, so absence of sewage or SARS-CoV-2 RNA in wastewater, but occasionally they enter the red zone, so presence. Sometimes that is because it's wastewater that is servicing the quarantine hotels, but sometimes it's also areas that don't service that, and then they move in with the health authorities to warn the public, to get tested, to increase testing opportunities, to bring that to these areas. So what are the growing pains? And that is environmental surveillance is sitting between worlds, or it's usually in the environmental world, while this is really a health world, and these worlds have to come together. So that's why I said in the beginning, it has to be a combination of these worlds. To be doing the surveillance at a national scale. Netherlands is a small country, so it's possible to do it with one institute and one lab to test everything. But if the scale becomes larger, it has to be a collaboration of institutes and laboratories and water authorities and health authorities to work together. And then, of course, interlab quality assurance of the tests, and also discussion on what rise in RNA signal in wastewater would inform public health decisions. So the next steps are that I see worldwide happening is to make sure that the quality of sewage surveillance is up to standard, that the value of sewage surveillance is up to standard. So we are collating best practices of the collaboration, and we're also capturing that in a global data network to also see how sewage surveillance can be of use not only in countries like the Netherlands, but also in Africa and South Asia. And of course, sewage as a mirror of society is something that we have been working on at KWR, for instance, for illicit drugs. But many people are working on it for polio surveillance, for antimicrobial resistance. So we see sewage as not only as a waste, but also as an important information source that we now use in this pandemic, but can also be used for other elements of society. Thank you.